Welcome to Healthcare Intelligence. I'm your host, Matt Meyer, and this broadcast is brought to you by Telligen, where every day we strive to help people live their healthiest lives. On today's episode, we are discussing the subject matter of our most recent Healthcare Intelligence piece on Telligen.com, titled Guiding, Not Directing: The Art of Practice Facilitation. As healthcare organizations face pressure to improve patient outcomes while maintaining costs and efficiencies, practice facilitation has emerged as a game-changing solution. And today, I'm excited to learn more about it from our guest, Brittany Rodriguez. Brittany is a manager of quality improvement at Telligen, where she currently works on the Oklahoma Health Management Program. A multi-state board-certified RN, Brittany's background includes valuable clinical experience in both ICU and ER settings at a regional hospital. Welcome to the podcast, Brittany. We are so lucky to have you. Thank you for joining us. Before we get into the meat of our podcast, I'd love to learn a little bit about you. So what can you tell me? What about you gets you up in the morning? What do you get excited about? What is it about Telligen that brought you here?
Yeah, thanks for having me. I've been looking forward to this day and getting to have this conversation with you for weeks. So, a little bit about me is that I'm an extrovert through and through. I love working and collaborating on projects in work settings as well as outside of them. So, I tend to find myself in lots of groups and lots of projects and lots of organizations volunteering and helping. But I think the thing that I look forward to the most is I love spending time with my kids and mostly being outside. We really enjoy gardening through growing flowers and even food when we're lucky.
Well, that's great. Well, and you and I have really only gotten to interact virtually, so more of the same today, but I always appreciate just how much energy and passion you bring to that day-to-day work and really making a difference in the contracts and the work that we do. So I'm excited equally to have you here today and just learn a little bit more about practice facilitation.
I'm glad to be here and I love talking about it. So this is definitely the place to be.
Awesome. Okay, well, let's jump right into it. So Brittany, our practice facilitation expert, let's start with what practice facilitation is. Why is it so important? Why is it so valuable to our healthcare providers, our healthcare systems?
Yeah, if I'm being honest, I didn't know what practice facilitation was 10 years ago. And really, it was emerging and becoming more and more popular. But in layman terms, practice facilitation in healthcare is a supportive service where trained professionals known as facilitators work alongside primary care practices to help them implement evidence-based improvements. These facilitators guide teams in strengthening their quality, their workflow, their teamwork, and patient outcomes by providing very tailored coaching, giving data feedback, and providing them resources. It's like having a trusted coach to help healthcare practices make meaningful and sustainable changes.
Oh, that's great. You know, I suppose with your background as an ICU nurse, ER nurse, you're so focused on what's right in front of you, the patient right in front of you. Sometimes these broader terms or quality initiatives really are kind of secondary to the task at hand.
Exactly. It's especially when you're in the moment with those patients. That is your concern, and we want it to be as a healthcare provider. So as a practice facilitator, we can come in and really have that 1,000-foot view for them that sometimes is a little hard to see when we're providing direct patient care.
Terrific. Well, great. Well, now I and our listeners have a little bit better understanding of what practice facilitation is. Maybe can you take us through how it's evolved? You know, you said it was fairly a new term for you 10 years ago. What's changed in the last decade? Why is practice facilitation more important maybe than it was 10 years ago?
I really think the biggest change that's happened is really just how we capture data in healthcare these days. Technology has been a huge piece of healthcare and the conversations we're having and how we're providing care for our patients. And as you know, it's ever evolving with the increase of AI use and more. Many years ago, AHRQ, which is the organization who really founded practice facilitation, they gave a suggestion really to do our work more manually. So we were going in and doing manual audits on patient charts that often were on paper. And now there's been a massive shift where everything is more electronic and they're really integrating systems into one another. And so I think over the years, the biggest change with practice facilitation has been that going from a manual to a more automated approach to how we're gathering and using data.
Oh, it's fascinating. Yeah, just technology has changed the game. And then with, the inception of AI, it really has really raised the bar or probably expanded the impact practice facilitation can have in those healthcare settings.
Definitely. And I think that's really where practice facilitation comes into play is taking that information and then knowing what to do with it. Because there's so much information in the age of technology. We have access to so much, but it's really knowing how to utilize it.
Oh, that's great. That's great. So tell me how increasing the emphasis on data-driven healthcare, how does that impact practice facilitators helping organizations better utilize their analytics and maybe their EHR systems?
I think it really ties in with kind of what we've been talking about. We help those teams turn that EHR data, that electronic health record data, into meaningful action. And we do that. That means working with them to clean up how they're documenting and therefore billing, building useful reports within their system, and then how to use their analytics to help identify those gaps in care, which is really what we're focused on at the end of the day. And we can also help them track their quality measures. It's not just about having the data, it's about making sure it's accurate, accessible, and actually used to improve the patient care.
I've got it. Yeah. So tracking that quality, tracking almost in real time the impact those changes are having on outcomes, on improving that quality.
Right, because that's quality. Whenever we can see the data, make a change, and immediately get feedback, that's when we can be the most successful. And historically, we've had to wait on claims data. We've had to wait on getting that information back from the insurance company, which is often sometimes a 3-month delay. And when you're trying to improve care, that delay is really impactful. So having that real-time data from that provider in their system, it goes a long way.
Got it. Terrific. All right. So now we've talked about the data. We've talked about seeing how that impacts quality kind of in real time. Maybe walk me through what that typical assessment process looks like. What does it look like at the micro level? What are our assessors doing? What does that first engagement look like for them? What are the questions they're asking?
When we first engage with a new healthcare practice, the assessment process is really about listening and learning.
Yeah.
We typically start with a structured practice assessment or a baseline evaluation, and it covers areas like workflow, team roles, use of their EHR, quality metrics, and improvement goals. We might even do staff interviews, observe clinic operations, and review some of their data reports that they already have. It's not just a checklist. It's really about understanding the practice's unique culture, challenges, and their strengths. From there, we co-develop with them. We're collaborating always on a plan that's realistic and tailored directly to their needs. And our goal is to meet them exactly where they are, because that's really how we build trust with those providers who are often facing things like burnout and being asked to do things from multiple levels. And we feel that starting there is the best place to be.
Got it. Great. So I heard a lot of collaboration. I mean, it sounds like, and I assume that this is not a one-way dictation where you are coming in and you are directing a healthcare organization on this is what you have to do. It's really working collaboratively with a goal in mind and finding the best path that works for that organization.
Yeah, you're exactly right. I think that's the benefit on our side of being practice facilitators or providing technical assistance is really that we get to be the good guys. We're not punitive. We are here for them and to advocate for them and to really help them work through these things on the front end. So before those auditors come, before they're getting surveyed, and to really close those gaps in care preventatively.
Right. And I suppose transparency in that process has got to be so important. I mean, you really have to know, like, what are the challenges that each organization is facing. They need to be really upfront and kind of raise their hand when there's KPIs, when there's data that just shows there are areas for improvement.
Yeah, it takes a lot of bravery on their part to actually say something and to admit maybe where their faults are, because when someone's coming in and scoring you or evaluating you, our inclination is not to point them to the low parts. Right? We're human,
Yeah.
and we understand that all of these people that are in these clinics that we're working with are also human alongside us. And so I think by us being realistic, honest, and really collaborating with them, they find that they're able to be more honest about these things so we can actually help them and work through them.
Fantastic. So are there challenges that you often run into during these assessments? What are some of the barriers that you typically have to overcome to kind of really make an impact?
Each facility type and location really brings their own unique challenges and advantages. An example really is in some of our rural areas, there's usually a gap in their access to healthcare. And often that looks like resources or specialists. And so sometimes it's just being very creative in how we're collaborating with them and helping those providers. In the past, an example that Telligen has done is really to help create access to care through things like healthcare fairs, or by helping an organization partner with someone like an eye doctor who can come into their clinic one day a month and see all of their diabetic patients. So we really are getting creative in these unique situations where patients are driving maybe an hour or 2 hours just to get to care that is evidence-based. So we're helping those providers in those unique situations close care gaps. And really, I think that's some of the unique challenges that we face, is coming up with solutions to those type of concerns.
That really is interesting. Each healthcare organization is unique. You mentioned the rural settings and just lack of access. I'm curious, is there a particular client or practice that you've worked with or your team has worked with that you came in and you really moved the needle, or an impact that you're really proud of in a recent assessment?
I often think of this one particular organization because the outcomes were just so clear, which is a great thing to have when you're working in quality. Because sometimes, even though we're seeing real improvements, having the data at a large level to back it up can be hard. It's hard to ask someone to track that, to finally follow through on it. But we do have it. So one example that I like referring back to is an organization that's rather large for their area, but it's still very rural in Oklahoma. And they had been working with Telligen on closing their diabetic care gaps, specifically on their patients getting their diabetic labs drawn. So just getting the labs taken in general. And so we worked with them through all of the steps that you've heard us talk about in this podcast. We did the assessments. We looked through everything. We're working through root cause analysis with them. Why was this happening? And once we really got to the root of the problem, we were able to identify a decently easy fix. We realized that due to the clinic not having an in-office lab, that most of their patients were actually using one specific lab in town because it's rural, so there was only one lab to go to. And so there wasn't great communication between that lab and that organization. And so as the practice facilitator, Telligen brought those people together to the same table to fix this problem in that community. And we didn't just do it for a one-time fix. We really created sustainable change. And we did that by bringing the lab's IT team and the organization's team to the table where they could create a direct pathway that carried real-time lab results from the lab in town directly back to the organization's EHR, where the provider could see those results immediately.
Wow.
And so by taking out the human piece of it, we didn't need someone to fax the document and for a secretary to scan it into the right place and for the EHR to scan that document to put the result in the right place. Just by creating that pathway, we were able to create that sustainable change. So that will long outlive any of us that worked on that project. And by doing that, the provider was able to see those labs quickly and intervene as needed. And so we have great stories of how that provider then caught some people who had an A1C that was 13, which is getting pretty high. That needs immediate action. And they were able to actually do something about that very quickly. And so even outside of that patient impact, we were able to see that they had over 30% increase in what we call compliance and quality. So their patients that actually got their labs completed. So they had 30% of their patients that were not, or looked like they were not getting their labs drawn. But just by connecting the dots between those two organizations, we were able to show that actually they were. We just didn't have record of it. So I think that sometimes is the type of work that is pretty interesting and unique and just takes some thinking outside of the box to really improve the care.
Wow. Yeah, you're working with the system that you have or the elements that are in place and just finding a way to really just make it work a little better. Sometimes you can find efficiencies in the current system without completely turning on its head.
Right.
All right. So a question that's been weighing on my mind is we often read about healthcare burnout and just how widespread it is, how much of an issue that can have on quality and quality measures. Is there anything practice facilitation can do or has done to really impact that concept of healthcare burnout?
It really has become so critical in the last few years to address this as a healthcare organization. And practice facilitation plays a key role in reducing that healthcare workforce burnout by helping practices streamline those workflows, clarifying roles, and then improving their team communication. A lot of burnout comes from inefficient systems and feeling overwhelmed or even unsupported. So as facilitators, we work side by side with staff to identify what's not working through things like that staff interview that we do at our initial assessment. And maybe even it's something like documentation is taking too long or people are duplicating tasks. We then go and collaborate with that organization to come up with a solution. Sometimes small changes like redesigning a huddle or adjusting how tasks are delegated can have a really big impact.
I bet.
We also create space for staff to step back, reflect, and be a part of that improvement process, which boosts engagement and morale in the entire clinic.
Oh, very cool. One last question. You've talked about how practice facilitation has evolved over the years, leveraged data, built on collaboration and creativity. That's great. Where do you really see the future of practice facilitation going? What's next? What is the next tool or piece of technology that will really take it to the next level?
Well, as technology becomes more advanced, think AI, remote monitoring, complex EHR systems, practices need even more support than ever to navigate it all. Facilitators will play a bigger role in helping teams integrate these tools in ways that actually enhance care rather than adding more burden.
Got it.
I also see facilitation expanding into areas like health equity, behavioral health integration, value-based care. The core won't change. We'll still be the trusted partner, helping practices adapt and improve. But I think the scope and skills that we bring to the table will continue growing as the system does.
Well, great. Well, I have certainly learned a lot. I've gained a newfound respect for you and your role and your entire team's role. So thank you for the work you're doing. Thank you for joining this podcast, getting me up to speed as well as our listeners. It's been really beneficial.
Yeah, thanks for having me on. It's always fun to get to talk about the impacts on healthcare.
Wonderful. Well, thank you, Brittany. And thank you to everyone for listening. We hope that you've enjoyed our podcast today. This podcast was recorded at Trilec Studio with Brooke Schaffner, engineering. Producers for this episode are Chris English and Tammy Lichtenberg. If you have questions or would like to know more about Telligen, please visit us at our website, telligen.com. Thank you and see you all soon.